Well, we test dogs for heartworm using antigen tests, and they pick up the antigen produced by the adult female worms. And we've relied on the sensitivity and specificity of antigen tests for identifying heartworm infection in dogs for decades, and they're wonderful tests. What we recently identified, though, through some research at Oklahoma State University, is that some dogs will test false negative on antigen tests, and the reason they do that is different than all the reasons we've known about for years. We know if dogs have immature worms or very few worms, we may not be able to detect the antigen because there's not enough antigen there. What we recently identified is that some dogs have enough antigen there, we should be able to detect it, but it's actually masked by production of antigen-antibody complexes, and so it's pulled out of detection. It's not available for detection by the test. And what we've learned is that if we heat those samples for a few minutes before we run the antigen test, we're able to convert those samples from negative to positive and identify the infections. It's a fairly simple procedure. You just take the serum sample from the dog or the cat, you place it at 100 degrees Celsius. We actually did it at 104 degrees Celsius in the research paper, so a bit above boiling, for 10 minutes, and then you centrifuge down the coagulum that forms, take the supernatant, the liquid that's on top of that coagulum, and run the heartworm test on that. And that liquid on top of the coagulum will have the unmasked, unblocked antigen that'll now be available for detection. The other thing that veterinarians and technicians should do in practice to make sure they're identifying heartworm infection, particularly in dogs, is look for the microfilaria. That's what we did historically before we had antigen tests, and that's how we identify this phenomenon. So we've published about antigen blocking in canine and feline samples, and those papers are available in the scientific literature, and they're available through something called open access. So any veterinarian can go to the journal and click and find the research paper and read about how we did those studies and what the recommendations are to reverse the block.